Asthma is a chronic inflammatory disorder of the airways that causes recurrent episodes of wheezing, breathlessness, chest tightness, and cough, particularly at night and or early in the morning. It involves complex interactions between many cells and inflammatory mediators that result in inflammation, obstruction, increased airway responsiveness, episodic asthma symptoms. It is the most common type of asthma, usually beginning in childhood, and is a classic example of type 1 mediated hypersensitivity reaction. A positive family history is common. Atopic asthma is triggered by environmental antigens such as dust, pollen, animal dander, and foods. Infection can also trigger atopic asthma. Asthma often occurs in the allergic type of person. In such a person, the allergen-reagent reaction occurs in the bronchioles of the lungs due to precipitating factors and important mediators released from the mast cell is believed to be the slow-reacting substances that causes activities like spasm of the bronchial smooth muscles. Consequently, the person has difficulty breathing until the reactive products of the allergic reaction have been removed. Non-atopic forms of asthma do not have evidence of allergen sensitization, and skin test results usually are negative. A positive family history of asthma is less common. Respiratory infections due to viruses and inhaled air pollutants are common triggers. It is thought that virus-induced inflammation of the respiratory mucosa lowers the threshold of the subepithelial vagal receptors to irritant that damages the epithelium. The ultimate humoral and cellular mediators of airway obstructions are common to both atopic and non-atopic variants of asthma, so they are treated in similar ways. Comparison of a normal bronchus with that in patient with asthma. Note the accumulation of mucus in bronchial lumen resulting from an increase in the number of mucus secreting goblet cells in the mucosa and hypertrophy of the submucosal glands. Several pharmacological agents provoke asthma, aspirin being the most striking example. Patients with aspirin sensitivity shows bronchospasm. It is presumed that aspirin inhibits the cyclooxygenase pathway of arachidonic acid metabolism without affecting the lipoxygenase route, thereby shifting the balance of production toward leukotrienes that cause bronchial spasm. This form of asthma is stimulated by fumes, organic acid, and chemical dusts, gases, and other chemical. Asthma attacks usually develop after repeated exposure to the inciting antigens. Inhaled allergens elicit a dominated response favoring immunoglobulin E production. On exposure to antigen, the immediate reaction is triggered by antigen-induced cross-linking of immunoglobulin E bound to the immunoglobulin E receptors on the mast cells in the airways. These cells release performed mediators collectively either directly or through neuronal reflexes. The mediators induced bronchospasm, increased vascular permeability and mucus production, and recruit additional mediator releasing cells from the blood. An attack of asthma is characterized by severe dyspnea with wheezing. The chief difficulty lies in expiration. The victim labors to get air into the lungs and then cannot get it out, so that there is a progressive hyperinflation of the lungs with air trapped distal to the bronchi, which are constricted and filled with mucus and debris. Types of inflammation include acute inflammation, which is associated with early recruitment of the cells to the airways, subacute inflammation that is associated with recruited and resident cell activation, chronic inflammation with persistent cell damage and ongoing repair resulting in airways abnormalities. Submucosal mast cell which on exposure to triggering allergen release granule contents. This induces two waves of reaction, an early phase and a late phase. The early reaction is dominated by bronchoconstriction, increased mucus production. Bronchoconstriction is triggered by direct stimulation of subepithelial vagal receptors. The late phase reaction consists of inflammation with activation of eosinophils, neutrophils, and T cells. Inflammation leads to structural changes in bronchial wall, collectively referred to as airway remodeling. These changes include hypertrophy of bronchial smooth muscles and mucus glands, and increased vascularity and deposition of subepithelial collagen, which may occur as early as several years before initiation of symptoms. Diagnosis can be done by basic tests like peak flow that measure how quickly you can breathe out, pulse oximetry by measuring the amount of oxygen in your blood, nitric oxide measurement that measure amount of nitric oxide gas you have in your breath when you exhale, spirometry which measures how much air you can breathe out in 1 second. The goals of asthma therapy are to decrease the intensity and frequency of asthma symptoms and the degree to which the patient is limited by these symptoms. 2 drugs are categorized for the treatment of asthma: anti-inflammatory drugs and bronchodilators.